This is our community analysis on Dr. Phillips in the greater Orlando area by Renee Gonzalez, Melinda Laurel, and Erica Rossies. The objectives of this presentation are to provide a historical overview, a community analysis of structure, population, environment, health-related resources, and government and public policies related to Orlando, Florida, with intermittent focus on the Dr. Phillips community. There will be a prioritized list of community problems and conclude with a global community issue. Orlando has come a long way. In 1856, the community officially changed its name to Orlando and became a city. Amazingly, in 1875, Orlando had a population of 85, with 22 of its residents qualifying as registered voters. In 1905, Dr. Phillips purchased an orange grove on the south side of Sand Lake. In 1950, Dr. Phillips helped in establishing the hospital known now as the Dr. P. Phillips Hospital. In 1965, Walt Disney chose Orlando over Tampa and Miami as the location to open the Walt Disney World theme park. Currently, Orlando is the tourist capital of the world, hosting more than 50 million visitors a year. Orlando has continually met the needs of the community by providing adequate housing and increasing transit options. Orlando continues to grow and make improvements to roadways and neighborhoods in order to provide an adequate community for its people. Mayor Jacobs has created an Invest in Our Home for Life initiative, which has allowed for multiple programs and projects aimed directly at expanding access to affordable housing to the homeless population. Orlando has also programs to assist current low-income homeowners with rehabilitative services to their home that may pose a potential risk to their health or safety. Orlando has 126 elementary schools, 35 middle schools, 4 K-8 schools, and 19 high schools that serve their community. Students in Orange Public Schools come from 200 different countries and speak 167 different languages and dialects. OCPS helps to meet the students' needs by providing a program called English as a Second Language, which was created to assist students with learning the English language in school while being taught in their native language as well. They also offer programs and dual enrollment for the students to get a head start on a college degree. Orlando provides their community with different places of worship for people of different religious beliefs. With Orlando being such a large, spread out community, alternative modes of transportation is very important. Orlando has many highways to bypass and decrease congestion on regular city roads. Orlando has a city bus service called Lynx, which includes 77 daily local bus routes and provides more than 105,000 passengers trips every weekday. Orlando also has a commuter train rail called Sunrail. Sunrail travels from Sand Lake Road in Orlando to DeBary with many convenient stops in between, which will soon include Kissimmee. Orlando has grown enormously over the past 10 years, and road construction has not been able to keep up. There are many projects being constructed in order to alleviate the congestion on the major roads and highways. By the time they are finished, it will more than likely be time to reconstruct in order to accommodate the ever-growing population. Overcrowding of school is a lot like the issue. Orlando has a very hard time keeping up with the population growth to accommodate children in public schools. Orlando continues to look for ways to improve school overcrowding, but has yet to be successful. Today, Orlando is the largest city in Central Florida, which is bordered by Tampa and Daytona Beach. The city of Orlando's population is at an all-time high of 270,934 people. There was only one issue found with the population according to the data collected. This was the fact that the poverty level is 20.2%. Neighboring communities such as DeLand only had 13.08% of their population living in poverty. Living below poverty level has been proven to contribute to negative long-term health effects. As for the public health concerns in the state of Florida, the most common sexually transmitted diseases are chlamydia and gonorrhea. The leading causes of death are heart disease, coming in at number 1, and cancer following closely behind at number 2. When comparing the health concerns of Orlando to other communities near, it is evident that the top health concerns of heart problems, cancer, and diabetes were consistent across geographic areas. These health concerns make it apparent that the Orlando community needs to be educated on diet, exercise, and diabetic compliance, especially with the Hispanic and African American population that make up this community. Many of these health concerns are prevalent in these cultural backgrounds.
Dr. Phillips Hospital. Dr. Hospital is the nearest hospital in the Dr. Phillips community. It provides healthcare access to the residents of the Southwest Orange County region and to Orlando's growing tourist population. Services include heart, vascular, cancer, urology, orthopedics, general surgery, and emergent care services. Hospitalization costs are based on services rendered and most insurance companies accepted. Additionally, the hospital offers financial assistance and payment plan options for low-income individuals. There are also many healthcare facilities and healthcare-related services available in the area. These include Brookdale Senior.
The following Healthy People 2020 objectives were chosen for the Orlando area: access to health care, heart disease and stroke, and substance abuse. Access to health care services remains one of the leading determinants of health among people in the Orlando area. Heart disease and stroke are among the top 10 leading causes of death in Orlando, and substance abuse is negatively impacting the individuals within the Orlando community. The goal of these objectives are to reduce the number of individuals who are unable to obtain care services and delays of health care, decrease heart attack and stroke numbers through the prevention, detection, and treatment of risk factors, and implement services for the mentally ill and individuals with substance abuse disorders. The Dr. Phillips and Greater Orlando area adequately provides a variety of environment resources. These include parks, community centers, and tourist attractions. The area boasts a wide variety of activities and locals which easily meet the recreational, social, and health needs of the community. An individual could literally walk to some of the world's hottest tourist spots. There are several community centers that offer a wide range of services from recreational to fitness. There are activities for all age groups, including yoga, meditation, crochet, support groups, and various other fitness classes. The goal of the community center is to promote the health and wellness of the Dr. Phillips area and people. The safety needs of Dr. Phillips and the Greater Orlando area are adequately met by the Orlando Police Department and the Orlando Fire Department. The quick response times proves that these departments are effectively responding and meeting the needs of their community members. Both departments offer a wide variety of programs, including educational programs, emergency preparedness, and safety courses. Dr. Phillips water is mainly supplied by Orlando Utilities Commission. The most accessible and economical source of water in Orlando comes directly from underneath the community and the Floridian Aquifer. The City of Orlando provides pickup of solid waste and yard waste, which includes grass clippings, leaves, branches, and environmental concerns that were identified during the windshield survey include inadequate roadways, streets, bike lanes, and sidewalks. The roadways and streets are uneven and contain potholes. Additionally, they are too narrow and insufficient to adapt to the growing population. Dr. Phillips' proximity to theme parks, attractions, and International Drive cause its roads and streets to be overcrowded. Additional concerns include lack of bike lanes throughout some of the major streets. This causes bicyclists to ride on the streets or in the sidewalks. Lastly, uneven sidewalks pose a serious environmental threat. This places individuals at risk for falls and their associated complications.
The City of Orlando is governed by a city council consisting of 6 members elected from each district and by a mayor elected by the people. Currently, Buddy Dyer is serving as mayor of the City of Orlando. He has served as mayor since 2003. His main responsibilities include governing the residents of Orlando and overseeing city employees. His obligation is to manage and improve the budget of the city, establish rules and regulations for residents and employees of the city, and to develop and propose policies. Additionally, responsible for appointing the city's attorneys, clerks, administrators, boards, and commissions with approval from the city council. The City Council of Orlando is comprised of 6 districts, each with an elected council representative. The term for city council members is 4 years. The council acts as legislative body, which is responsible for approving the mayor's appointment, creating and changing existing laws, as well as collecting city taxes. The mayor and the council commissioners can be contacted via email or mail with questions and concerns. Additionally, all board meetings are recorded and available with minutes online for residential pleasure.
Healthcare accessibility is extremely important because without it, a community will not receive the care that is needed. Access to community health centers are very important in both healthcare delivery and improved neighborhood economic activity. They also provide convenience to individuals that may otherwise not have the means to travel long distances to receive healthcare services. When an individual does not have health insurance, the burden to pay for health services rendered becomes the patient's responsibility. This fact alone can cause a patient to choose to suffer in silence for fear of not having the funds to pay for their health care. According to the National Healthcare Quality Report, health insurance was the most significant contributing factor to poor quality of care for some of the core measures. Uninsured people were less likely to get recommended care for disease prevention, such as cancer screening, dental care, counseling about diet and exercise, and flu vaccinations. They were also less likely to get recommended care for disease management, such as diabetes care management. Narcotic abuse is a reality for many elderly patients that take numerous medications for multiple ailments. The high rates of comorbidities in older populations, changes in drug metabolism, and the potential for drug interactions can attribute to a more dangerous situation than in younger populations. Further, a larger percentage of older adults also use the over-the-counter medications and dietary supplement, which can compound any adverse health consequences resulting from prescription drug abuse. Homelessness is an ongoing issue that contributes to many long-term health problems. The homeless population continues to have an increased rate of infectious diseases as well as chronic medical conditions, ranging from community-acquired pneumonia, tuberculosis, and HIV to cardiovascular disease and chronic obstructive lung disease. These issues make this population very vulnerable to health problems. Currently, STDs are affecting young adults. Most of all, sexually transmitted diseases continue to be a significant healthcare concern and an area that requires consistent education regarding safe healthcare practices. Education in this regard is crucial and should continue to be enforced in the future. With 1.1 million people living with STDs in the United States, 6,786 of those individuals live in the Orange County area. The most common STD in the state of Florida, according to the CDC, is chlamydia. Living in the Sunshine State is imperative to practice adequate skin care and protection of UV rays. Patients should be encouraged the use of SPF 30 and apply every 2 to 3 hours while exposed to sunlight. The #1 skin cancer in Florida continues to be basal cell carcinoma, followed by melanoma. Education about skin care protection should start at an early age, considering that most squamous cell carcinomas arise from sun damage due to unprotected exposure during childhood. Healthcare disparities are healthcare differences related to social, economic, and environmental disadvantages. Individuals affected are comprised of groups of many racial and ethnic minorities, religious minorities, and low socioeconomic status, to name a few. The group most affected are African Americans. These individuals face many challenges in regards to proper healthcare education, preventative healthcare measures, family planning, and overall accessibility. A staggering 55% of individuals infected with HIV in the county are African American. Orlando has an organization that provides assistance to these individuals called Shepherd's Hope. It is a charitable organization where individuals can receive prescription assistance and free healthcare workup. Other initiatives also include raising awareness, strengthening patient-provider relationships, and having affordable healthcare plans. Many other countries offer free healthcare to their citizens. It is amazing that as the world leader, the United States of America has not joined this bandwagon. Studies show that people in these countries lead happier and healthier lives. Could free healthcare be the answer?